Ma'am, you're recognized. Please state your name.
My name is Melissa Woodford. I am with Florida Family Policy Council in support of this bill. I would like to read a testimony of a doctor who wished he could be here today, but wanted his testimony read. He is a healthcare professional and a retired family physician. He says he would never be able to refer for an abortion or be able to accomplish an abortion in any way. His sister, who is deceased, Kathy Joyce, MD, was an anesthesiologist. She was constantly harassed about her unwillingness to provide anesthesiology services for abortions. He would also never be able to assist a patient who wanted to change their gender in doing so. That is his specific belief. He says, I am certain many other Christian doctors share my concerns. This bill would allow for Christians to be able to protect their conscience objections to things like providing or prescribing an abortion or abortion-inducing drugs. This bill would protect these rights of people to follow their conscience, and it respects diversity in the medical profession. This is a just bill, this is a good bill, and we need to enact this bill because it will allow for these things to continue.
Thank you.
It will allow these.
Appreciate that. Thank you so much.
Thank you so much.
Shyla Dragon, followed by Aaron DiPietro, John Harris, Mazer. You all three are recognized. Please come forward. Sir, please state your name. You have 1 minute.
Shiloh Dragon is in support of this bill. She had to step out. My name is Aaron DiPietro on behalf of Florida Family Policy Council, and rather than telling you my own perspective, I'm going to read the testimony of a doctor that wished she could be here today. Dear Honorable Representatives, as a physician, I've been in medical practice for almost 30 years and in private practice in Gainesville, Florida for 21 years. I was one of a handful of doctors in 2016 who helped make healthcare rights of conscience part of the Florida Medical Association policy. I dedicated my efforts toward this legislation because I feel that the right of conscience is critically important for providing the best care for my patients. Especially now, I feel that physicians are in a pivotal place, needing to be an advocate for their patients. I am supporting the HELP Act because providing the best care for my patients is my #1 priority. We as physicians need to be able to work with and for our patients while still being able to listen to our conscience and be whole and congruent to offer the best recommendations to our patients. Patients need to know that their doctors have a conscience and are willing to follow it on their behalf.
Thank you, sir.
Thank you.
Appreciate it. John Harris.